Ardens has a comprehensive solution to managing the seasonal flu vaccinations each year, but even more so for this year because it is quite a complicated year already. As you can see, we have a set of support articles which you can find at support.ardens.org.uk, and using the search to search for flu, and you should find lots of articles. The latest instructions that have been released by Public Health England on the 5th of August mention the expansion of the programme. So you can see on that document, if you haven't seen it, there's a link to that from the support articles. It talks about household contacts of shielding patients, children of school age year 7, health and social care workers, although this was included in previous years. They seem to have expanded this slightly to include more health and social care workers this year. And then later in the season it mentions that you'll also need to include 50 to 64-year-olds as well. But I think this is being phased in and is dependent on vaccine availabilities. The vaccines are very similar to last year, so no great changes there. The biggest challenge this year is obviously COVID-19, and in particular how practices can safely deliver vaccinations in a PPP environment. We've already seen many innovative plans posted on places like Facebook, etc., talking of utilising car parks, village halls, drive-through systems, different ways to use IT in particular in all those different environments, and such as barcode on letters. NHS England have also set an uptake ambition of at least 75% across most of the groups, which is obviously higher than previous years. So you have a higher ambition target, you have more patients in your group, and obviously more difficulties this year with the environments as well. NHS Digital are hosting some webinars this year for the flu campaign. In particular, these will be looking at the technology side of things, and hopefully tips and tricks of how to make it more efficient for the practices, particularly this year with the difficulties. There is one date at the moment for 20th of August, but I would imagine they will be recording it and probably releasing further dates, but the link will be on the support article as well. So the first thing we're going to show you is some of the reports that we've got. We have a set of reports under reporting. So if you go to reporting at the top, down to clinical reporting, and when it opens, if I just scroll to the top of my list, you'll see a folder called Ardens Limited. If that's not expanded, if you expand it, scroll down the list until you get to a folder called Vaccinations, and in that folder you will find a set of folders for the seasonal influenza vaccinations, and the first one there is called Review Before. So these reports have been put in place to help you look at your patients before you invite them in, hopefully. So the first two are PSD reports, but we'll come back to those in a minute. So for the review before ordering and invitations, obviously the orders have already gone in. The orders would have been in since last year, probably in some cases, but these may help you for next year's ordering. So the first one there, aged less than 18 and aspirin in the last 6 months, there is a contraindication for that, so that's why that report is there. Again, you need to get your clinicians to look at those patients to check those out before you invite them in for a particular type of vaccine. The next one, check as influenza allergy anaphylaxis. So there's been a previous recorded allergy in the patient's record, so those need checking before you invite those in. It could be that it was an error, or it may no longer be a case that they have an allergy, so that they can be invited in quite safely. Then we have a report to show patients that are in care homes. So it's important each year to do a bit of a tidy up on the care homes. Patients in care homes get marked with a local residential institute code, which unfortunately we can't set up reports for. we can only report on read codes. So there is a separate support article which is linked from the flu clinic's support article, which shows how to tidy those patients up. But if they're not coded, then they won't get pulled into the main reports. Check if patients are still housebound. So lots of patients get coded as housebound, and perhaps they're not permanently housebound, just temporarily. So they should be taken off the housebound register. So some patients you have coded with housebound might get invited, but they don't actually, they're not eligible to be housebound anymore. You may also have patients who have become housebound who haven't been coded, so it's worth getting your GPs and nurses just to check their list of patients. Check if patients are still pregnant. So this does cause a few issues each year, where some females are recorded as pregnant, and then for whatever reason there's an issue during the pregnancy. They maybe have a miscarriage or something else, and it's not recorded properly in the record. They're still marked as pregnant, and then they get an invite in the post, which can be quite distressing for the patients, and obviously cause complaints to the practice. So it's worth a check of that register to make sure that those patients are still pregnant, and the coding is correct. Medications from hospitals is also an issue, and it depends how these are recorded as to whether we can pick these up in the reports. So again, you can break this down, you can look at the issues of medications, and get your GPs to look at those. And then we have 4 reports that are looking to add the 90X4 code, which is the code that makes patients eligible for a flu and for payment. And as in previous years, that code should be added after the 1st of September. If it's added before then the business rules don't pick it up, or may not pick it up. So the first one there, vaccination indicated as a carer, not in another risk group. In previous years, we've discovered that the carers are not automatically included in the business rules, although they should be. So that's why that report's there. So you may have to code your carers with 90X4 again this year. We're not sure yet. If vaccination indicated as coded in previous years and not in, just extend that, in an age or a risk group. So in previous years, you may have coded patients with 90X4 because there was a clinical need to vaccinate. And again, this year, those patients may not also fall into a risk group this year. So those patients should really be reviewed again to see whether they should have their vaccination again this year. And because they're not in a risk group, again, this year, that code 90X4 will have to be reapplied. And then the next one, we've got vaccination indicated as COVID-19, moderate high risk without a more recent low risk and not eligible. So some of the patients you have coded with moderate or high risk for COVID-19 don't actually fall into one of the usual flu risks. Most of the patients do, but some of the patients won't. Therefore, there will be a small number of patients you need to look through, and if it's considered clinically appropriate, then they need to be coded 90X4 as well. As in previous years, we've already had reports that multiple sclerosis seems to be one of the areas that's missing from the business rules again. So there's a report there to identify patients who suffer with multiple sclerosis who are not in another risk group, who should be reviewed, and again, if it's clinically appropriate, then they should have the 90X4 code applied. And then going down the list a bit further, we have considered contacting these given by other provider last year. So this is giving you the opportunity to chase all the patients who went elsewhere last year to pharmacies to have their flu vaccinations, and try and increase your practice uptake and obviously practice income. Consider recording splenic disorder, if appropriate, as infectious mononucleosis, I think it's called. So this particular condition should really, or potentially should have a recording of a splenic disorder. that would then force them into the correct risk groups. And the last one there, record mobile number. We have an SMS consent perhaps on the patient, but for some reason there's no mobile number recorded. So maybe it was recorded in the past, it's been taken off, and the consent is still on there. You just need to chase the patients for these, and if it's still appropriate, if they still give their consent, and record their mobile numbers, and then you can use those for the invites and everything else. So the next one we're going to look at is ordering. So the next folder down. You might think it's strange that we have these reports here at this time of year because you've already done your orders. So what's the point? Well, these reports have actually been here for most of the year for you to use if you needed them. And actually this year it might be appropriate to have these reports throughout the year because you might be doing some more ordering at some point if there's any vaccines available. And also you can use these, you can base your next year's orders on these figures, and already we're hearing some practices are being asked to submit orders for next flu season, which is absolutely crazy, but that's the way the world is, and I think you can get quite a good discount if you order early enough. So we have all the different age groups, the different vaccine types broken down, so you can quite easily work out how many vaccines you need. The one group that you will notice is missing from this is the 50 to 64-year-olds, which we haven't included in the ordering. We're not completely sure how practices are going to be purchasing or acquiring the vaccines for that age group, whether they're going to be centrally supplied. So we may end up adding in another report into this list at some point. The next folder we come to is the eligible. So this folder shows broken down by different groups all of the eligibility. So we'll just quickly work our way through it just to explain what each different area is. So from the top there we have the eligible all, excluding the additional COVID-19 cohorts, and also including those as well. So this is including the high risk and medium risk patients. So moving down then we have the different age groups, so 6 months to 2 years in a clinical risk or other risk group. We have all the 2 to 3 year olds, and then we move on to the school ages. So we have the 4 to 11 year olds, which are in a clinical or other risk group, which can be done by the practice, or the 4 to 11 year olds, which are not in a clinical risk group, which should normally be done by the school program. And then we have the 12 to 17 year olds in a clinical risk group, 18 to 64, and the new group, as it says, they're not to be included in the invitations just yet, 50 to 64 year olds and 65 plus. We have another one there for 65 plus, which includes any patients who are in an additional clinical or other risk group, because I believe some practices have been asked to prioritize in that particular way. And then we have again, just showing you different ways to look at the same data really. So the 18-64 year olds, and these are all except care homes and housebound, 50-64, 65 plus, and 65 and 65 again. And then we have the reports to show for the ethnicity as well, again broken down, care homes and housebound, and individual reports for those as well. And the next group is for care homes, so we have some separate reports for those, and then separate reports for COVID-19 high risk, and again care homes and housebound are separated in those as well. Housebound patients, just the housebound patients this time, and then the QOF patients, which is also important as well. And then the bottom couple of lists is showing you all the different groups, so by conditions, and then we've got the other as well, so carers and healthcare and social workers. So moving on to the next set of folders for the invitations. We've done it slightly differently this year. We've got 3 separate folders for invitations, hopefully not making it too complicated for you. But the first folder is everybody over the age of 18, excluding housebound and residential care. And you can see you can quite easily send your first, second and third invitations by SMS, email or post. We've changed the priority this year because everybody's saying that they want to send by SMS first. So we've gone for SMS first, email second and post third. And we've added in the code that should be used for each of these different methods of communication. So once you've sent off your batch of SMS, just remember to add that code. That will then move them on to the second and third invitation. The next set of invitation reports is broken down a little bit further into the different age groups, the school groups, and etc. So you can be more specific if you want to. And then the third group of invitations again is broken down slightly different again to show the ethnicity, COVID-19, learning disabilities patients who perhaps might need to be invited in a slightly different way. Cough patients, some practices are asking to target those in particular, and that's for the first, second and going down to third as well. So a very comprehensive list of invitation reports, and it's entirely up to your practice which ones you do, how you do that. You will see on the template on the resources tab, which we'll come to in a minute, there are some invitation letters that we've put on there from NHS England for some of the different groups, but we've also included on that letter a barcoded NHS number as well, which lots of practices are asking for this year. So now we come to actually recording the flu vaccination. So in a patient record, if the patient is eligible, you should see under their demographics the little symbol there. If you put your cursor over, it should tell you eligible for influenza vaccination. And also on the patient's home screen, you'll see a eligible for influenza vaccination link as well. If you click on the action, it takes you to the template. If you click on the symbol, it takes you to the template. But what some people like to do is use the F12 launcher, which is like a shortcut if you've never used this before. If you type in the search box influenza, click on search, you'll find seasonal influenza vaccination, and you can then drag it across to whichever shortcut you want. So if I drag it to F, for example, when I close that, if I now push F12, I can do F, and it launches the flu template for me. So that's quite useful for lots of different templates, for nurses in particular who use regularly the same template for travel vaccinations, for child IMS, and etc. etc. So if the flu symbol for whatever reason isn't showing, you can get to that template quite easily by using your launcher. And the final way to find it is down the bottom search feature. You can just type influenza in there, and it says seasonal influenza vaccination. So you see, when we did it that way, it took us to the home page of the template. But if I just close that again and go to the shortcut, it takes me to the right tab for that patient. So this patient is 80, so it's taken me to the over 65s tab. And depending on the age of the patient, it will take you to the individual tabs for those patients. So a bit of a time saver there, hopefully. Unfortunately, on my screen, I'm on a laptop, so I do have these scroll bars which have appeared following a TPP update, but you shouldn't see those if you're working on a workstation. they are quite useful. I mean, if you're on a small screen, you can use that to scroll up and down, but it just looks a bit odd when you first see it. So on the home screen, you'll see there's links to all the different tabs, but also there's two views that we put on there. One for the reason for the eligibility. So in this case, obviously the patient's over 65, but they've also had diabetic retinopathy. It doesn't look like they're diagnosed with diabetes for some reason, but this is a test patient. And then we have the vaccination history. So if there was any previous vaccinations given, any declines, any allergies, they'll all show there as well. So this patient is over 65, so we can work our way through the template. So we've got the usual advice given, consents, fit for IMS, and we have the invitation codes there as well if you want to use that to record the codes. All the usual contraindications, but you can check for allergies and sensitivities if you really want to at that stage as well. And then we've got a little drop-down list for the codes for the health and social care workers, to record those if they're not already recorded. And moving on to the PGT PSDs. So is it giving under a PSD or a PGD? And then we have separate documents that'll take you to those as well. Electronic PSDs, so you can add an electronic PSD, and if you click on the little symbol with the plus to the right, you'll see whatever PSDs are available for this particular patient. So we can just, whichever we choose to give, basically. Whether they've declined, and you can record a refusal correctly through the vaccinations node by clicking on that link, and whether it's been given by somebody else, given elsewhere, so by midwife, pharmacist, etc. And there is also a given by other link there as well, which will take you to another way to record those. So you can record those by just adding a read code, but the best way is to add it by adding the vaccination. If you record a vaccination given by other, you should really go to the details and change the event details as well, so that it doesn't record it as given in the practice, because you may end up getting paid for those incorrectly. And then moving down, we have the actual vaccination. So in this case, there are only two options, but you've also got the option to using the vaccination templates if you want to set up your own in-house vaccination templates to make it easier for your staff. You can do that, and that will take you to a link to a list of all of your local templates. And again, the support article covers how to set those up if you're not sure how to do that. And then at the bottom of this one, we've got the AF screening options as well, which you don't have to use, but they're there if you want to. So all of the different tabs are set up pretty much similar to those across the top, but the vaccines are specific to those age groups for that tab. And as you can see, they do change as we go across, and so on. And the 4 to 11-year-olds, it should be done as part of the school program unless at risk. So you can vaccinate those that are at risk. And then we've got the cohorts. So there is a tab that explains that the 50 to 64-year-old cohort will be added at a later stage, but they're not currently included in the invitations. And then a resources page with a few links to various guidances, Green Book instructions, NHS employers, NHS England, and you can tick to say a leaflet's been given. You can send an SMS or an email from here if you want to, and these are where the specific NHS England invitation letters have been set up, which have the barcodes linked to them as well for the NHS numbers. One question we are often asked on the support desk is about producing FP10s for seasonal flu vaccinations. You don't need to produce an FP10 as these are an FP34 item, and you can see that by going to the top menu to set up vaccinations and available vaccinations. And this list shows you all different vaccinations available in System 1, but it shows you the script type as well. So where there's an FP34, this is because it's a a large volume item and doesn't require an FP10. And you can see the influenza vaccinations are all labelled with the FP34. So there is no requirement to do an FP10 for these. There is also no requirement to recode a flu vaccination. Many practices think that there is, but there isn't. As long as you record it as a vaccination, it will get picked up by the payment reports in the usual way. So we mentioned on the template that you can record an electronic PSD. They can be done on the day or from a appointment rota, but also if you recall, if we go back to the reporting, clinical reporting, on the review before, if you remember, we had some reports for PSDs, so you can run these in advance. These are patients who've had a flu vaccination in previous years, so the risks are slightly less. You could run those in advance and print those off for the GPs to go through to add electronic PSD in advance. But as you can see, the numbers are probably going to be quite high, but those reports are there if you want to do that. You can also do it from an appointment screen as well. We do have a support article which explains how to record vaccinations in a batch, normally from the appointment screen. So in previous years, I'm not quite sure how it's going to work this year, but in previous years where some practices do large clinics, perhaps on a weekend, on a Saturday, they might do maybe 1,000 patients, and at the end of the day, somebody would go through and record those in a batch from the appointment screen. Obviously this year is going to be slightly different, the way practices are going to have to work, but it is possible to do that if that's still something that you want to do. There are a few stages to go through. First, by looking at this support article, it explains how to tidy up the vaccination batch numbers before you do that, how to add a vaccination template, which is useful for this process, the event details, and which might be useful for this year if you're doing it elsewhere as well, and recording vaccines from the appointment screen, so you can see how you access that by right-clicking the header of the appointment rota and choosing actions, going to vaccination clinic, and then you work your way through the list of patients on that rota, and it applies the vaccination to every patient that you choose to. You will be prompted to set up different bits at different stages, and then it's a case of clicking through each one, but it's much quicker than recording individual vaccinations. But obviously this year is a very different situation. But that support article is available, and just by searching for recording vaccinations, you should find that on our support portal. So after you've done your clinics, it's a good idea to review some of the records, to do a bit of tidying up. So we have a folder there, review after, with a set of reports that you can use to hopefully tidy up the data, make sure everything's recorded correctly, and hopefully increase your income as well. So just quickly go through this list. So we can see the first one there is about 90X4. So you might find that some of the patients that you've vaccinated were asked to come in by a GP or a clinician because of a certain clinical need to have the flu vaccination, but for whatever reason it wasn't recorded on their record with 90X4. So you might need to go back through those, get your GPs to review them and add that 90X4 code. If you don't add that code, then you won't get paid for them. Consider reason why the patient went elsewhere. So again, constantly reviewing these patients who have gone elsewhere to pharmacies locally or wherever, and trying to work out the reasons why they went elsewhere. They could be recorded by event details or by read code as well. Consider recording as no response. So you might have had no response to 2 invites. Lots of people still use 3 invites, so we've got another report there for the 3rd invite as well. So officially for QOF it is only 2 invites, but it's still good practice, we feel, to send 3 invites. So it is there to look at as well. Recording one vaccination in error, duplicate vaccination recorded. So quite often this happens, recording from documents coming into the practice, vaccinations being done in clinics, where you'll end up with duplicate vaccinations recorded for whatever reason. It may be genuine that the patient required 2 doses of vaccine, but in most cases it's probably going to be an error, so you need to go back through those records and remove one of those. Otherwise you will get paid twice. Consider recording vaccination contents given. It was only recorded as a read code, so you might want to be more specific. Go back through those records and tidy those up, where they've just been coded as a read code, and add the actual vaccination as well. Non-QOF code. So this was one that came out last year, where we found that some practices were using a non-QOF code to record vaccinations. So again, this should identify those if it's still being used this year. Vaccination declined. Again, that's a non-QOF code, so it's looking for non-QOF codes again, just to tidy those records up. And not recognised BM's form. So hopefully those reports will help after your clinics to tidy up your data, to maximise on your income, and to keep the records as accurate and up to date as possible. So we have a number of reports that will show your actual activity. So the next folder down is a list of reports showing activity, broken down by all patients, given by healthcare providers, given by pharmacists elsewhere, and given here as in your practice. There are a number of issues I just want to mention with this one, where patients may be vaccinated by a hub. We have heard some stories where the data is quite difficult to get from a hub when practices are trying to claim individually for their patients, because the reports are set up to only identify activity here at your practice, and that's the way the business rules are set from NHS England and NHS Digital. You can see all the other invitations activity as well, so any invitations you've sent and coded. Reasons for refusals are declined as well, so that's quite useful. And then the actual CQRS payments, if we go back to the left hand side and scroll up the list of folders, you'll see one for contracts current financial year CQRS. So if we open that, you can see it's broken down by annual, by quarterly, and monthly as well. So for September, we've got the first set of CQRS flu activity reports for payment set up. So these are quite new. These have only been in place for a couple of days, and these will be added to, because the child ones are not on there yet, but they will be available in time for the first data extract for CQRS, which we believe is in October. But you can use these to measure against the CQRS numbers, and quite often there are differences, but hopefully the differences are quite small, and you can look at those patients to work out what's gone wrong. Maybe it's a coding issue, maybe it's something that the CQRS reports are not including that we are including. So again, it might be a case of adding the 90X4 code to make those eligible. But it depends on what stage of the month you do that as to whether you would then have to submit a manual submission to your local area team for those extra vaccinations that you've given that haven't been pulled out by CQRS. So that's everything covered. That's our comprehensive solution to managing the seasonal flu vaccinations this year. And as always, if there are any questions or anything that you want to be added in, or you think that we should add in that would be helpful to you and lots of other practices, please do let us know in the usual way, through Facebook, through email, and telephone, and we'll pick those up, and if we can, we will implement them, as long as it follows the national guidance.